The placebo effect is a truly fascinating and powerful phenomenon that reveals the deep connection between our minds and our bodies. It demonstrates how our beliefs and expectations can create tangible physical change. A placebo is a treatment with no therapeutic value. It could be a simple sugar pill, a saline injection, a sham procedure. The placebo effect is the measurable improvement, the observable improvement or the felt improvement in health or behavior, not due to an active treatment. It stems from the patient's firm belief they are receiving an effective intervention. It's not imagination or pretending to feel better. It causes real physiological changes that can be studied. When someone takes what they believe is a potent painkiller, the brain can respond as if it received one. Participating in a medical ritual, visiting a doctor, receiving a prescription, following a treatment regimen can trigger the response. Context, trust, expectation of healing unlock the body's capacity to provide relief and show the mind as an active participant in wellness. The placebo effect's strength varies by person and many factors. How a treatment is presented matters. A placebo injection often outperforms a placebo pill, likely because injections feel more medically significant and invasive. Pill color can matter. Blue pills often suggest calm, red pills suggest stimulation. These details show how brains process symbols and rituals to form expectations. Ultimately, the placebo effect challenges the idea that medicine is only about chemicals. It introduces a third element, the patient's psychology. Healing is complex, it's influenced by treatments and the stories we hear about them, the environment of care, and the deep-seated hope we carry for recovery. The brain is not passive, it's an active agent in healing. The mystery of the placebo effect begins to unravel when we look inside the human brain, which acts as a sophisticated internal pharmacy. When a person genuinely expects a treatment to work, their brain can initiate a cascade of neurochemical changes that mimic the effects of an actual drug. One of the most well-understood mechanisms involves the release of endorphins. Endorphins are the body's natural painkillers, opioids produced by the central nervous system that function to inhibit the communication of pain signals. When a patient believes they are receiving a powerful pain reliever, their brain can ramp up the production of these very chemicals, leading to a genuine reduction in their perception of pain. This is not a subjective illusion. It is a measurable biological event. Advanced brain imaging techniques, such as functional magnetic resonance imaging, have allowed researchers to observe these changes in real time. In studies involving pain, scientists have seen that when a person experiences relief from a placebo, the areas of the brain associated with pain processing show decreased activity. This provides concrete evidence that the expectation of relief triggers a top-down regulation of pain, where the brain's higher cognitive functions directly influence how sensory information is processed and experienced. The pain is not just being ignored, its signal is genuinely being dampened at a neurological level. Beyond pain relief, the placebo effect can also influence other bodily systems by tapping into different neurotransmitter pathways. For example, in studies related to Parkinson's disease, a condition characterized by a deficiency of the neurotransmitter dopamine, patients given a placebo have shown temporary improvements in motor control. Brain scans revealed that this was accompanied by a release of dopamine in key motor areas of the brain. The expectation of improvement triggered the very brain chemical that the disease depletes. This demonstrates that the brain's predictive power can mobilize specific chemical messengers tailored to the expected outcome: pain relief, mood elevation, improved motor function. This process is deeply intertwined with the psychological concepts of expectation and conditioning. Expectation is the conscious belief that a treatment will produce a certain result. Conditioning, on the other hand, is a more automatic, learned response. If a person has previously taken a medication that successfully relieved their symptoms, their body can become conditioned to associate the act of taking a pill with feeling better. Over time, even a look-alike pill with no active ingredient can trigger that same learned healing response. Just as positive expectation can heal, negative expectation can harm the nocebo, the placebo's dark twin. Nocebo means, I shall harm. A patient gets worse simply because they expect harm. Told a drug may cause headaches, told it may cause nausea, told it may cause fatigue. Patients may experience each symptom even on an inert sugar pill. Mind and body are neutral, they can be steered toward healing or toward harm. Nocebo mechanisms mirror placebo in reverse. Placebos release endorphins, release dopamine. Nocebos trigger anxiety and stress pathways. Anticipation of pain, release of cholecystokinin. Cholecystokinin facilitates pain transmission and can counteract natural opioids. Fear and anxiety increase pain sensitivity, a self-fulfilling prophecy born from negative beliefs. Section 4. The clinical proving ground, placebos in medical research. In the world of medical research, the placebo is an indispensable tool used to establish the true efficacy of a new drug or treatment. The gold standard for testing new interventions is the randomized, double-blind, placebo-controlled trial. In this type of study, participants are randomly assigned to one of at least two groups. One group receives the active treatment being tested, while the other group receives a placebo that looks identical, tastes identical, feels identical to the real thing. Crucially, double-blind means that neither the participants nor the researchers interacting with them know who is receiving the active treatment and who is receiving the placebo until the study is complete. This rigorous design is essential for filtering out the powerful influence of belief and expectation. If a new drug is to be considered effective, it must demonstrate a benefit that is statistically superior to the benefit observed in the placebo group. For example, if 40% improve on a drug and 30% on placebo, the chemical-specific gain is only 10%. The results from these trials consistently highlight how potent the placebo effect can be across a wide range of conditions. In studies for pain management, it is not uncommon for placebos to achieve 50% or more of the relief provided by powerful opioid drugs, like morphine. Similarly, in trials for antidepressants, placebo groups often show significant improvements in mood, sometimes approaching the level of the active drug, especially in cases of mild to moderate depression. These findings do not mean the drugs are ineffective. Rather, they underscore that a large part of the healing process for these conditions is mediated by the patient's psychological state. Conditions with strong subjective components, pain, anxiety, depression, fatigue, irritable bowel syndrome, tend to show robust placebo responses. The symptoms of these ailments are heavily modulated by the brain's interpretation of bodily signals. Section 5. Everyday miracles. The placebo in daily medical practice. While the formal use of inert placebos is confined to research, the principles of the placebo effect operate in nearly every clinic interaction. The positive atmosphere of the therapeutic encounter itself acts as a powerful, non-deceptive placebo. The doctor's reassuring tone, the doctor's expression of empathy and confidence, the crisp white coat, the diplomas on the wall, all these things build trust and expectation of a positive outcome, enhancing active treatments. A kind word can be as important as a prescription. Consider a doctor listening attentively to a patient's concerns. Validation and care reduce anxiety and foster hope, which lowers stress hormones and alters symptom perception. The ritual of a physical exam, a clear diagnosis and well-explained treatment plan gives control and predictability in a time of uncertainty. This comfort can trigger the same neurochemical pathways as a formal placebo, amplifying healing and improving adherence. Section 6. The limits of the mind. What placebos cannot do. While the placebo effect is a testament to the mind's profound influence over the body, it is crucial to maintain a balanced and realistic perspective on its capabilities. The placebo is a powerful tool for modulating symptoms, but it is not a cure-all. Its effects have clear and important limitations. A placebo cannot, for instance, shrink a cancerous tumor, unclog a blocked artery, eliminate a viral or bacterial infection. It does not address the underlying pathophysiology of many diseases. A sugar pill will not mend a broken bone, reverse organ damage from diabetes, stop the progression of Alzheimer's disease. The primary domain of the placebo effect lies in symptoms regulated or heavily influenced by the brain, often called subjective outcomes: pain, nausea, fatigue, anxiety, depression, insomnia. Because the brain is the ultimate arbiter of these sensations, it can dial them up or down through neurochemical adjustments. The placebo effect changes our perception of internal state. However, when a disease is independent of the brain's direct regulation, like viral replication or malignant growth, belief and expectation alone are insufficient to halt it. Section 7. The ethical compass. Navigating placebos in patient care. The potent reality of the placebo effect presents the medical community with a significant ethical puzzle. On one hand, there is a clear potential to alleviate suffering by harnessing a patient's belief. On the other hand, the traditional method of administering a placebo involves deception, giving a patient an inert substance while leading them to believe it's an active medication. This act of dishonesty directly conflicts with the core principles of modern medical ethics, patient autonomy, informed consent, and a foundation of trust between the physician and the patient. Knowingly deceiving a patient, even with good intentions, can damage this crucial relationship. For this reason, the use of deceptive placebos in routine clinical practice is widely considered unethical. However, recent research into open-label placebos offers a fascinating and ethically sound path forward. In these studies, participants are explicitly told that they are being given a placebo containing no active medication. They are informed about the placebo effect and told that the body can create a healing response simply through the ritual of taking a pill. Remarkably, many still experience significant relief, suggesting the ritual and positive suggestion can work without deception. Ultimately, the most ethical way to leverage the placebo effect in everyday medicine is to focus on enhancing the therapeutic context without resorting to inert pills. This involves creating a strong patient-provider relationship, creating a trusting relationship, and fostering an empathetic connection. It means practicing excellent communication, providing reassurance, and fostering a sense of partnership in the healing process. Doctors can frame treatments in a positive light, manage patient expectations constructively, and create an environment that maximizes feelings of hope and control. In this way, the spirit of the placebo effect can be harnessed not by misleading patients, but by enriching the very fabric of compassionate, patient-centered care.